feel you because I used to have a melasma also, and I understand completely where it come from. So basically, as I mentioned to you, when I had my melasma, it was not as dark as yours, honestly, but it was very intense. So what happened to me was, as soon as I have my son, I had melasma. Melasma started to show up in my whole face. Basically, I have a lot of it in my forehead. I had also in my nose and my cheeks. The most common in cheeks, but also had it here. It was, oh God, it was horrible because no makeup was covering, and I did so much thing and nothing was helping me. And at that time, what happened was I used to go to you know, a doctor to check what I could be done for my to brighten my melasma. And a lot of dermatologists, what they did to me was giving me creams, and that make my melasma so much worse. But also irritated, but so much worse, much darker as soon as I stop it, or I miss few days. Also lasers. That lasers is one of those things that honestly, personally, I don't like for melasma, because what is melasma? Melasma is triggered by hormonal changing, and also is triggered by heat. Let's say when you change your hormones, first is genetic. Okay, so if your melasma just show when you have a hormone change, or stress levels, like a very high stress levels, or also, since it's genetic, they're always gonna be there, right? So what will trigger when you have a baby? Well, we go to hormone change, like a menopause, a premenopause. So that is when you start to notice the melasma. And the melasma, normally what happens is they start to show in a very little, most of the time, they show in this area here or in the forehead in a very little, spot. And if you don't treat them, since they are under the skin, they start to really grow all over. It's like almost spreads all over from in out. Okay. And at that time, 20, my son is 26 years now, and I had my son 2 years later. It was where I found a treatment that I could treat melasma. And I have to do myself because, I was going, as I mentioned to you before, I was going to a lot of different dermatologists, and they always recommend things that was making my melasma worse. So I did my homework, and then I start to create things to treat my melasma. And then the way I personally like to treat melasma is not treating only with, pills, microneedling. That's a lot of people treat melasma in that way. And then I had patients complaining with me before that they done all the treatments you can imagine, and nothing get rid of it. As you mentioned also that you done so much treatments, but nothing worked for you. And that was one of my biggest concern when I started to treat melasma. And now that I focus a lot on treating melasma, and my genuine interest is always when somebody comes to me, and I can relate it to you, and I can relate to so many of you out there, that when we treat melasma, we have to be strategic, right? We have to treat the root cause also in this case, which is melasma from inside. So because if you do just treatment superficial, it's not going to do nothing for you. And if you treat melasma with a wrong protocol, they're going to make the melasma create more inflammation, and more inflammation means more pigment. So we have to work on block the pigment formation, but also treat the cells that's already pigment, that's already dark, right? So what I do is a combinations of 3 treatments together with a very, very specific melasma brightening as a home care. That is non-negotiable, because if I do a treatment in the office and then you go home and I don't do things that we're supposed to be doing as a part of protocol, guess what happened? You're going to throw your investment in the trash, which is, I don't want it for you, And my actually full interest when you come to me is helping you get your skin back, get like brighter skin, even toner skin, right? And also the ability just to think go out without makeup, or just go to the beach, or just go to the pool without having the fears of, oh my God, that melasma, if I get the sun melasma, I'm gonna go crazy on me again, and I'm not gonna be able to do anything because that's how affect you, right? So that's what I specify to all my patients. Okay, your product is including your package, is including your treatment plan. That is not an option for you to not do at home. Otherwise, everything else is not going to be working. It's going to work halfway. So because a sunscreen with a melanocytes, that is the pigmentation production, we're going to stop it. So the sunscreen that we have to use is towards melasma, towards pigment balance. Pigments corrected too. And it's not just a sunscreen which you just protect the skin from the sun. No, we would use a sunscreen which is going to protect the sun 100%, but also going to be working for you to block the melanocytes, but also to brighten the skin. Then you're going to have a home care that you're going to use at night. Then you're going to have a home care you're going to use morning, night. So I'm going to send you, and also going to have a home care which is going to protect the barrier of your skin to not cause inflammation. So going to be the whole thing is we need to have a little patience, because in your skin, for example, there is a little bit severe, and we will have probably 6 months treatment. It's not 1 or 2 treatments going to give you what you have in mind to have. And that's what I love to mention to you, but to all of my patients when they come to see me is, when we treat melasma, if you want to do the right treatment, which is we can regulate the melasma for them to not come back anymore, which is, I like to be very honest with all my patients, is as I told you, I had melasma 26 years ago. I treated them 2 years later, my son birth. So 24 years now that I never had melasma coming back to me. I know that is genetic. I know probably it's there, down there somehow, but the way I did is I keep it in control. Means by using sunscreen, and I love to use my moisturizer, my brightening products at home anyways, right? So mine uses something that's going to benefit me, knowing that melasma is a condition. And if I keep it in control, I never have to worry about it. And as I don't know if you can see, I don't wear much makeup, but my skin, I don't have to cover melasma because I don't have melasma anymore. So, and a lot of people ask me, is melasma something gonna get rid forever? And I tell them, I'll be lying to you, telling you, promising you things that I cannot control, which is I will treat the melasma to not show to your skin, to actually block and treat it. Like I pull the pigment from the cells out of your skin, treat the cells with melasma. So, and then we pull the skin, the pigmentation in to out. So you're going to treat inside, but also out. So we're going to attack the melasma for all angles. Okay. And then you will do your homework to keep them in control, and your skin is smooth for as long as you can, which is if you protect your skin from the sun, for example, or also heat. You know, everything that creates heat to your skin can trigger the melasma to do, right? So I do lasers today in my skin. I don't have pigments because my melasma is in control. And as soon as we do a lot of little things that normally I recommend for you to do in at home too, you're gonna have your melasma in control for, hopefully 25 years like I did. Okay. But yes, I will create the plan that we're talking about, right? And I will put step by step together, and then we can get you set up for your appointment. And another thing I forgot to tell you too is you asked me what you could expect after you do the treatment. If your skin gonna get too red, if you're gonna have how much downtime you're gonna have. And one thing, Diana, that I have to mention to you is um, with the home care I'm going to give it to you too will help you to keep your skin as less inflamed as possible, which is very beneficial for the results also, and timing as well of resulting. Um, so your skin gonna get red for the first day, the second day, and the third day, like a pinkish and dry, and then the treatment gonna do the process of pulling the pigments. So the pigments that will look a little darker then until it peels off. It breaks off and peels off. So the total, I would say downtime vary between 5 to 7 days, the first one. And but we're gonna keep in touch with you to make sure that if you need, okay, Marek, I need a little bit of information. How can I do my home care? So after your treatment, we always follow up with you and get all the information that to help you to keep everything as should be. Okay, but you don't have. It's not painful. Is people ask, can I put makeup? I say 24 hours after. Yes, we can do makeup, and also you don't swelling. Some areas you feel a little bit swollen, like most of the time, like you have to this eye area here can feel a little swollen, but not crazy. Something like very, very minimal. But you can go out normally with the sunscreen. Okay, I will advise you how to use the sunscreen, but also all the products at home too. And you will look normal. Let's say after 2 or 3 days, you will look not red, but kind of like a drying peeling. But it's part of the process, and it's very, very normal. Okay, but very minimal downtime, but it's so worth it. Let's say that it's so worth it. Okay, so I will send everything to you, and then we will create your appointment as soon as you give me the dates that you are ready for. Okay, bye bye, darling.